All right, welcome back. Hope you're having a great week. Today we're continuing our review of our BCBA exam practice questions, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, please check out behavioranalyststudy.com. We offer 3 practice exams, a task list study guide, and of course, our famous combo pack. As always, when you do pass your exam, please let us know so we can include you in our Sunday shout out. Work hard, study hard. Let's get to our questions. Question 1. Cece is a major procrastinator. She constantly waits until the last day and sometimes the last minute to complete work and assignments. Whenever that last day arrives, though, she diligently completes the work that is required and always gets a good grade. The last day arriving functions as what? Many of us can relate to Cece and this procrastination behavior. What we're looking at here in the question, though, is the last day. And the last day essentially is an antecedent to diligently completing the work. Once the work is completed, what happens? She gets a good grade. That's essentially our ABC contingency here, right? The last day arrives is our antecedent. Completing the work is the behavior. Getting a good grade is the consequence. So we're looking at the last day, which is an antecedent, meaning we're thinking in terms of SDs or MOs. And what is happening here? Well, of course, her behavior, right, is being evoked. We have an evocative effect here, okay? So do we have a behavior altering MO, a function altering effect, or an SD for completing the work? Well, let's start with the SD. It's not going to be an SD. And why? Well, the SD signals that reinforcement or a consequence is available. And there's always a consequence available for doing the work. The last day arriving doesn't suddenly make this consequence appear, right? The consequence is getting the good grade. It doesn't suddenly make that consequence appear. So it isn't an SD because at any point, she can engage in the behavior. And at any point, and when she turns in that behavior or when she turns in the work, the good grade or the grade is always available. The last day arriving doesn't change the fact that the grade is available or not available. So it isn't an SD. What we're dealing with here is a motivating operation. What is happening is there's an establishing operation that is having an evocative effect on behavior. So it's altering her behavior temporarily. The last day arrives, and all of a sudden, all these behaviors are being evoked that weren't previously in place. The motivation to complete the work is now extremely high. The want to complete the work is now extremely high. Nothing is being abolished here, right? And there's no abative effect. We have an evocative effect, and it's temporary. Remember, MOs have temporary effects on behavior. So when you compare that to a function-altering effect, function-altering effects are consequences. Consequences change future behavior. MOs change current behavior. And that's a very important distinction here. She's going to continue to procrastinate in the future. Temporarily, though, her behavior has changed. And since it's temporarily changed, it's just a simple behavior-altering MO. So, in this case, the last day arriving functions as a behavior-altering establishing operation. This is not that easy of a question. Make sure you understand the difference between behavior-altering, function-altering, and then the difference between SDs and MOs. Very, very important. You need to go back to Cooper and look at these specific terms. This is a question that once you understand it becomes much easier. But if you don't have a good understanding of all these different terms, it can be very challenging. The following scenario represents what type of lag reinforcement schedule. A behavior technician sits in front of 3 young children and tells them that they are going to take turns naming different animals. She says that the only way to earn a token is to give a different answer than the child before them. We're looking at lag reinforcement schedules here, which we don't talk about often. I very rarely hear it in practice. And if it ever comes up, people have trouble with it. So this is a good refresher and a good fluency check. So what do we mean by a lag reinforcement schedule? With the lag reinforcement schedule, you're basically telling the learner that you can answer the question a certain way to start, but depending on the lag, you need to change your next answer. So if I have a lag 0 schedule, then it doesn't matter what your answer is. You're always going to get the reinforcement. If I have a lag 1 schedule, you can give me the first answer, but the following answer needs to be different in order to get reinforcement. A lag 2 schedule says your answer needs to be different than the last two answers to receive reinforcement. And you can see how they build on each other. So lag reinforcement schedules are actually a pretty effective way to reinforce, especially in a group or when trying to teach novel behaviors. If you implemented a lag 2 schedule and you're doing categories, then your learner could give you an answer, give you another answer, and then that third answer would need to be different than those last two answers to receive reinforcement. So with that said, let's look at the behavior technician. What type of schedule is she running? She says they're going to take turns naming different animals, and the only way to earn a token is to give a different answer than the child before them. So the answer needs to be different than the answer right before them. Only one away, right? So is this a lag 0, 1, 2, or 3? Well, since it's only one away, it's going to be considered a lag 1 schedule. Now, lag reinforcement schedules are not something, again, we discuss very often. It might be something you need to go back and review. But the concept is very easy to understand. And it's also extremely effective in practice. So make sure you add this to your repertoire when you start your BCBA work because it is very effective, especially in group settings. A student wants to get into law school, so she must first take the LSAT, which is the law school admissions test. The student takes baseline on questions she answers correctly prior to starting the study. Assume the graph below represents 4 different potential baseline data paths. Which data path would you not want to intervene in on at this time? This is a pretty straightforward question. It's asking you and it's testing your knowledge of when do we begin intervention, right? And when we're taking baseline, before you start intervention, we have to think about what is our goal of intervention. Are we increasing, decreasing? What's the goal? In this case, what is our goal? Well, she wants to get into law school, so she needs to get a good grade on the LSAT. And obviously, she wants to answer more questions correctly. So the graph here really should be increasing, right? So if you look at A, it's very stable. B, it is actually increasing. C, it's decreasing. And D, it's variable. Now, assuming these graphs are answers correct, which data path do we not want to intervene on at this time? A would be a great path to intervene on because it's very stable, right? She's essentially plateaued, if you want to look at it that way. C is decreasing. She needs to intervene immediately. She's getting worse at it. D is variable. While not perfect, it would be okay to start an intervention here, right? It's very unclear how her progress is going. But B, she's steadily increasing. Even without studying, her results are improving. Intervening here might actually have the opposite effect. It might make her worse at the test. Before she intervenes on B, she needs to wait for it to either stabilize or start to decrease. If we're trying to increase the behavior and baseline indicates the behavior's already increasing, there's no need to intervene. So which data path would you not want to intervene on at this time? Well, B. Her performance is already increasing without intervention. There's no need right now to intervene. Once it stabilizes or decreases, then she can start her intervention. After several months of intensive teaching, a client is finally potty trained at home. The parents and the BCBA are both ecstatic. The parents ask what is next, and the BCBA tells them that the behavior will now be monitored in the clinic for generalization. What has the BCBA done wrong? This is a obvious question when we think about it. What is happening here? What has the BCBA done wrong? So first off, we've got several months of teaching. Potty trains the client. That's great. Everybody's happy. Everybody's excited. The parent wants to know, well, what's next? The BCBA says, well, now we're going to monitor for generalization. That's the issue here. What's the problem with just monitoring for generalization? Well, this is a wait and see approach. And as BCBAs, we don't wait and see for generalization. Generalization is arguably the most important aspect of behavior change. Who cares if this kid can use the toilet at home if they can't use it in public? We haven't really done our job. So simply monitoring for generalization is not quite enough. So what has the BCBA done wrong? A, BCBAs should never guarantee results or outcomes of interventions. Well, I don't see anywhere in the question where the BCBA guaranteed anything. Remember, we are only using the information provided to us. Never add information that's not there. BCBA said we're just going to monitor it. They didn't guarantee anything. B, a generalization plan should have been created for potty training. Yes, long before they finished this intensive teaching, there should have been a plan in place for generalization. Simply just monitoring and basically hoping that generalization occurs is not proper intervention, is not proper therapy. That is an issue. Do we stop at B? No, we read all of our answer choices. C, it is unrealistic to expect the behavior to occur outside the home since it took the client so long to learn the behavior. Absolutely not. It is not unrealistic at all to expect generalization of behavior. And then D, the BCBA should have started in the clinic first, which is a more controlled environment than the home. No, there's nothing wrong with starting in the home. They taught them in the home. They need to learn it everywhere, right? So if they were able to teach it at home, seems like a good place to start. The problem here is the BCBA is now simply just going to wait and see. They're just hoping for generalization, which we cannot do. They have to have a plan in place. You have to create a generalization plan. We don't just wait and see. We plan for generalization. Joan has developed a habit of waking up and immediately checking her phone in the morning. This leads to Joan laying in bed for 30 to 45 minutes on her phone, which sometimes causes her to be late. Joan wants to change this behavior using applied behavior analysis concepts. What should she do? The key word here is habit. And in our literature, we have this idea of habit reversal. Now, habit reversal gives people trouble because at first glance, it does kind of sound like a mentalism, right? Kind of like a construct. Oh, well, you have this habit, okay? But we actually do have a term in the literature called habit reversal, which is an actual intervention. So Joan essentially needs to do what? Well, she essentially needs to implement habit reversal for this behavior of checking her phone in the morning, laying in bed, and being late. So what should she do if she wants to basically change her habit? A habit is a construct and cannot be targeted. Don't be fooled here. Habit reversal is actually in the literature, and it's a behavior analytic concept. B, she should ask her partner to lock her phone in a safe at night as a form of extinction. So B is a form of response blocking. She has no way to get to the phone. Response blocking is not extinction. Remember, extinction, you still have to give the opportunity to engage in the behavior. If the phone is in the safe and she can't get to it, she has no opportunity to engage in the behavior. It's not really on extinction. C, she should interrupt her behavior and engage in another behavior that is incompatible. Yes, habit reversal involves a multi-step intervention. Part of that intervention is interrupting the behavior chain as early as possible and engaging in another behavior that is incompatible. That is habit reversal. She needs to do something different in the morning. And then D, she needs to develop more willpower. Now, willpower is a construct. Willpower is not something we're going to target. What Jane needs to do is engage in habit reversal, and she's going to do that by interrupting her behavior and then engaging in another behavior that is incompatible with the current one of checking her phone, laying in bed, and then being late. So what is she doing? C. Tommy is old enough to go to the store by himself. His parents give him a list of items and give him a candy bar for helping, but he sometimes forgets to buy everything on the list. This time, his mom tells him that if he buys everything on the list, he will earn his candy bar, but if he forgets anything, he doesn't get to eat his candy bar. What type of intervention is this? We're looking at a differential reinforcement procedure here. One behavior gets reinforced, other behaviors withhold, extinct, right? Very straightforward DR procedure. So you have to ask yourself, well, what type of DR procedure are we looking at? Now, the quickest way to narrow down differential reinforcement questions is to ask yourself, are we teaching replacement behaviors? If we're teaching replacement behaviors, you're really only looking at a DRA or a DRI. In this case, what's the replacement behavior? Well, the replacement behavior is buying all the items and not forgetting items, right? He needs to buy all the items. So we're really looking at a DRA or a DRI because he's only earning the candy bar if he buys everything on the list. If he doesn't get his candy bar. So is it a DRA or is it a DRI, right? Are these behaviors alternatives or are they incompatible? Well, ask yourself, is it possible to buy everything on the list and then also forget something? Of course not. Those are incompatible. So what we're really doing is a DRI. We're teaching this incompatible behavior of buying everything as opposed to forgetting something on the list. So what type of intervention is this? Well, it's a differential reinforcement of incompatible Behavior. Pretty straightforward DR question. You're leading a group DTT session with 4 kids. You're going around the table and asking each client a question based on their skill level. Every 1 minute, a timer goes off, and another RBT puts a token on a token board. When the clients earn 5 tokens, they go on break. Which of the following describes the reinforcement schedule for delivering tokens? This is a basic reinforcement schedule question. It's not a compound schedule reinforcement question, but you need to know basic schedules as well. I meet with a lot of future BCBAs who know compound schedules, and then they neglect basic. You can't neglect anything, right? So in this case, what does our schedule look like? Well, we know we're getting tokens, and we're getting tokens when? Every 1 minute, the timer goes off. So are we dealing with a ratio schedule or an interval? Well, an interval. It's based on time. Is this interval fixed, or is it variable? Is it changing? Well, it's clearly fixed, right? So what type of reinforcement schedule is it? A, FR1. Well, we already said it's not a ratio schedule, so it can't be an FR1. B, FR5. Again, not a ratio schedule. Can't be 5. C, FI 5 minutes, right? So are we looking at 5 minutes here? Well, no, it's every 1 minute. So we're getting a token on a fixed interval 1 minute schedule. So which of the following describes the reinforcement schedule? Well, it's a fixed interval 1 minute. Every 1 minute the timer goes off, a response occurs, they get a token. Finally, a verbal operant involving a response that is evoked by both an MO and a nonverbal stimulus. This question comes up constantly, so I keep on going over it, okay? It's important that we review. What is the verbal operant that involves a response that is evoked by both an MO and a nonverbal stimulus? Well, the operant evoked by an MO is what? A mand. We all know that. An operant evoked by a nonverbal stimulus is typically a tact, okay? So when you combine a mand and a tact, what do you get? Do you get an impure mand or an impure tact? You get an impure tact, okay? In the literature, the verbal operant that is a combination of a mand, which is evoked by an MO, and a tact, which is evoked by a nonverbal stimulus, it's an impure tact. It is not an impure mand, okay? I just want to clarify this over and over, right? That's what we're doing in study, okay? Clarifying, learning, all right? And eventually the light bulb goes off and we remember it, okay? And that's the key. Fluency, repetition, and then we apply. So a verbal operant with a mand and a tact together is an impure tact. Excellent. Thank you for watching. Please like and subscribe. Check out behavioranalyststudy.com for our study materials. Work hard, study hard. See you soon.